Let's talk quickly today about the importance or understanding the role of the electronic fetal heart monitor when a baby has suffered a traumatic brain injury at birth like HIE. And in our context, HIE is hypoxic ischemic encephalopathy, and we are using or we're working from the definition of a reduction in oxygenated blood which can lead a baby to suffer a traumatic brain injury. Now, if you've been online and you have done any type of research on the electronic fetal heart monitor, you've probably seen information pro and con in regards to the electronic fetal heart monitor. And today I want to talk with you about why it can be extremely important when we are doing a birth injury investigation as to the cause of a baby's traumatic brain injury. So let me go ahead and let's back up and let me set the stage for you. Let's say that there is a labor and delivery, things are going on early in the process, the baby is not having any problems, just not having any problems. Everything is in the normal range as it pertains to the electronic fetal heart monitor. And by the way, that monitor, it's monitoring a lot of things. So it's looking at not only the baby heart rate, it's looking at that, it's looking at certain types of other things like whether there are accelerations that are present, whether there are decelerations that are present. It's looking at variability. It's looking at things like that. It's also looking at whether there are late decelerations or prolonged decelerations. It's looking at mom's contraction pattern, whether mom is having too many contractions over a given period of time. So it's an important device because what it's doing is as you're moving through in real time, it's making a record of what is happening to the baby as it pertains to those things that I just discussed. And so let's go back to the example. Let's say early on, the baby's heart rate is in the normal range, and that can be anywhere from about 120 beats per minute to about up to maybe about 160. And let's just say the baby's heart rate is within that normal range. There are some acceleration patterns that are there, so everything is looking kind of it's looking well. There doesn't seem to be any problems. Let's say that midway or halfway in between or halfway through labor and delivery, the baby is starting to have some problems. There are some complications that are beginning to arise, or baby is no longer tolerating that vaginal delivery. Now, normally, if you do not have the readings from the electronic fetal heart monitor, all you would essentially have is the word of the doctors and the nurses. And let's say in our example, the doctors and the nurses are saying there's nothing going on, baby was doing fine, they didn't see any problems, there was nothing that was giving them or putting them on notice that the baby was no longer tolerating the vaginal delivery. But let's say in our example, let's say that the readings on the monitor, remember I said that this monitor is tracking the baby in real time. Let's say that during that time frame, let's say that we have some absent variability going on. Let's say that we have late decelerations or prolonged decelerations are taking place during the middle part of labor and delivery. Let's add in there that mom is having too many contractions. Let's say there's tachycystole going on. Let's say we're having all of that, and for whatever reason, even though this is putting the doctors and the nurses on notice that there are problems, they, for whatever reason, do not take any action based on what they see. Let's say as time goes on, then we get to the end of the process. We've got delivery is happening, and now the baby comes out. Let's say the baby is blue in color. Let's say the baby has to be resuscitated. There's a handoff to the NICU. Subsequently, we have seizures. We have an ultrasound that's done. We have a 24-hour ultrasound that is done within that time frame, and that ultrasound is pretty much normal. Let's say we have an MRI that is subsequently done, and that MRI is showing brain damage, hypothermia cooling has been deployed. All of these things are happening. Now, when we go back into this example, if we do not have any readings from the electronic fetal heart monitor, the only thing that we have is essentially the word of the doctors and the nurses and the medical professionals that during that middle part, they didn't see anything wrong. There was nothing that was alerting them. So what I'm saying is that the electronic fetal heart monitor can play an important role in helping us be able to look back and see what was going on with baby during labor and delivery. During that middle part in my example, what was happening? Should the doctors and nurses, should they have notice certain things based on what was happening on the electronic fetal heart monitor. So I know I talked about a lot in this video, but I'm trying to help you understand just one aspect of why in our context, especially when we're doing a birth injury investigation for families, why the readings on the electronic fetal heart monitor are extremely important. And if you are concerned about the cause of your baby's HIE brain injury at birth, and you are requesting records on your own or by yourself, make sure that not only do you get the medical records for mom and baby, but make sure that you get a copy of those strips. You get a copy of the readings from the electronic fetal heart monitor. If you have more questions, maybe you're watching this video today because your baby has suffered an HIE injury and you have questions as to, what caused it, what happened, why did this happen. If you have that going on, what I invite you to do is to get your cell. There is a telephone number down below. Get your cell and give us a call. Give me a call. I talk with families like yours all the time about these issues. And remember to talk with me initially about your baby story. It costs you absolutely nothing to do that. When you talk to my office, call my office, make sure that you pick a good date and a time to get on my calendar. So we'll know when to talk with you or when to, schedule a call back so we can find out what happened with your baby situation. In addition to that, make sure that you have a good email address, an email address that you check frequently. Make sure that you have that, because sometimes we have to reach out and talk with you through email. So you just want to make sure you have a good working email address. And finally, I practice law in the state of Maryland. And I know from time to time I'll have individuals who will contact me. They are in the United States, but they are not in Maryland. If that is you, just understand that we have to use what we call co-counsel or local counsel, in other words, an attorney in your state. And that's something that we can work to help you with, but I just want to make sure that you understand that co-counsel or local counsel aspect of things if you are not in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law in the state of Maryland at Boston Law Group, LLC. Talk with you next time. Take care. Enjoy the rest of your day.